A very good afternoon, everyone. This is Panachai here with you. Welcome to another live session of Prime Health. Uh, a very important session today, as it is the 4th of May, and today the world is celebrating of the awareness of World Asthma Day, that is dedicated to the asthma today. Uh, we are going to talk about some misconceptions that are there related to asthma. So today our topic is going to be uncovering asthma misconceptions, and I have a very important special personality here with me, Dr. Ali Anwar, who's a specialist pulmonologist at Prime Healthcare Group, currently practicing in Prime Medical Center Barsha Height Branch and Prime Medical Center Burjuman. Dr. Ali has an extensive experience of 12 years, out of which he has been in UAE for the last 2.5 years. And we are going to get a lot of information. It will be a very healthy webinar, just to understand about the asthma and all what we need to know. Just wanted to tell you, please ask your questions in the comments related to asthma, and Dr. Ali is going to answer once he finishes his initial talk. Dr. Ali, thank you so very much for joining us today.
Hi, good afternoon. Thank you for having me here, and appreciate for your time. And I would also thank you for giving me this opportunity on this day of World Asthma Day, which basically is a campaign to create awareness among asthmatics and to clear that misconceptions.
Great, great. Thank you, Doctor. Doctor, we've got some questions that have come before the session, and there will be some questions that will be during the session. We'll be asking you those questions, but before we would like to really know on the topic we're discussing today is uncovering asthma misconceptions. What are the misconceptions that are there? If you can just put some light on that, that will be very great.
See, asthma basically is a very common problem, and it is it is a 100% controllable problem. Only thing is, you will have to have a proper asthma action plan. Discuss with your doctor. You should know what asthma is, what you can do in asthma, what are don'ts in asthma. Which medications you need to take in. So all these things, and how long you should take the medicine. So all these things are will be clear today in today's session, and we'll be covering a lot of issues regarding asthma in this COVID pandemics also. And basically, asthma is an inflammatory condition where your windpipes are inflamed, your windpipes are swollen, they become narrow, and then you will have these symptoms of breathlessness, wheezy chest, cough. In severe cases, you may also have this chest tightness, and some people even say they feel like they are breathing through a straw. So that is the level, that is the problem, symptoms of the asthma, which may vary from mild, moderate to even severe. So the main treatment for asthma is you will have to identify the possible trigger factors, which could be infections, which could be allergies, which could be pollution, which could be pollen, which could be change in climate, emotional disturbances. And once you have identified your trigger factors, and then you will have to be on inhalers. Basically, asthma, your doctor might prescribe you two main inhalers. One is controller and the other one is rescue inhaler. Control inhaler, as name suggests, it controls your symptoms. It uh, keeps your symptoms away whenever you are exposed to the trigger factors, and you should not stop your control medications even though you are 100% okay, and even though you don't experience asthma symptoms. Other one is the rescue inhaler, which, as again the name suggests, it rescues you from acute worsening of the symptoms, and you should always have this inhaler handy. And apart from the medications, the important thing is exercise. Asthma is not an excuse for avoiding exercise. You will have to exercise on a daily basis. You will have to take medications on a daily basis, and every year you need to take your uh, flu shots, vaccinations on annual basis. So if you are on regular medications and if you start exercising, your asthma will be controlled. You will not require any additional medications apart from this.
Okay, thank you so much, Doctor. Doctor, there are so many, as misconceptions. Again, I would say that people are actually talking about, and like, what would be the basic things that a person should look into when having an asthma?
Basic is you should know, you should have a proper asthma action plan discussed with your doctor. You should know what it looks like when it is severe. You should know what medications you should use in case you are getting symptoms are getting worse, and you should know when to visit a doctor in case your medications are not helping you. So if you know all these things, and also you should all be able to identify possible trigger factors. So once you are able to avoid trigger factors and step up your medications as suggested, then probably your asthma will not trouble you much.
Hmm. Doctor, I've got some questions here that came before the session actually. The question says, does my child need to take his medications only during an asthma attack?
No, this is a misconception. If your child is an asthmatic, you will have to give him medications for a very long time. As said, asthma is controllable. To have a good control, you should always be on an inhaler. When your symptoms are worse, your inhaler doses will go up, and when your symptoms are less, your doses will go down by 50%. Then you will always be on inhaler.
Mhm. Okay. Uh, Another question, doctor. What are the reasons why someone gets asthma and does it ever go away?
Asthma basically there are it's genetics also. If you have a family history of asthma, then there are more chances that you will develop asthma. If not in the childhood, if you are developing asthma late in your life, like teenagers or 30s, there is always a possibility of late onset asthma because of allergies or because of exposure to occupational exposures, because of exposure to dust and all those things. So once you're an asthmatic, you will have to be on regular medications.
All right. Doctor, when I feel fine, this is a question, and have no symptoms, does that mean that the asthma has gone away?
Asthma will never go away, but it can be 100% controlled. As I said before. So to have a good control, again, you should be on regular controller medications.
Okay, right. Right. Uh, Doctor, does asthma shorten the lifespan?
No, it doesn't. Until unless if you're not on a regular medications, you will have a frequent attacks, but it will not shorten the lifespan.
A question related to previous asked question: is asthma treatable only when symptoms are present, or
No, asthma is treatable. Definitely, it is 100% treatable, irrespective of you have symptoms or you don't have symptoms. But we would always recommend you to use medications irrespective if you don't have symptoms of asthma also.
okay, right? Uh, Doctor, are nebulizers the best way to give asthma medications to babies and children?
Yes, nebulizer is the best way for the babies because it has a deeper penetration into your lungs. It makes the child feel better faster than the inhalers.
Mhm. Oh, yeah, that's right. Doctor, talking about can inhaler overuse cause harm?
Inhaler overuse.
Yeah.
Uh, no, it will not.
Okay.
That's where we called rescue inhalers. But if rescue inhalers are not helping you, then obviously you will have to consult your doctor for further management.
Doctor, if my child takes asthma medicines every day for a long time, will it lose its effectiveness?
No, it will not.
It will not.
Asthma is basically a very long-term treatment. There are people with medications for decades, and they're doing well. They're leading a healthy lifestyle.
Doctor, what about should asthmatics avoid exercise
No,
and if
exercise is must.
exercise must and if
Exercise is
child
must.
has asthma, is he allowed to play like other kids?
Yes, He should. Every asthmatic has a right to lead a normal, healthy lifestyle. He can exercise like his colleagues, his fellows. There is no excuse for exercise in asthma.
Okay, great. Doctor, I've got a question here. Any specific diet we should suggest people diagnosed with asthma?
There is nothing specific, but you need to avoid anything which possibly is triggering your asthma. Why? Because some people are allergic to some food and some people are allergic to other food. So you will have to identify which food is troubling you, and then you should avoid anything which has cold. Avoid staying away from cold drinks and all those things. So other than that, you can always have a normal food.
Okay, great. Doctor, do all patients with allergic rhinitis develop asthma?
Not necessary, not necessary that if you have allergic rhinitis, you will have asthma, but there is always a suspicion that it might progress to asthma, but not necessarily it might extend and become an asthma in the later part of the life.
Okay, great. Thank you. Doctor, what precautions needs to be taken for COVID positive person with history of asthma?
Nothing specific. You need to have your medicines regularly, control your medicines. We don't want you to lose your asthma control, especially during this COVID times. We would encourage you to live the normal life, exercise, have a healthy diet. Otherwise, nothing specific. Why? Because asthma has not shown to have increased any risk. Asthma is not a risk factors for developing COVID. So you can have your medications on time and lead a normal life.
Okay. Doctor, thank you for answering all those questions. I've got another question I just wanted to ask you here. How to take care of asthma amid the current COVID situation?
Oh, so nothing specific. We would still recommend people to continue using inhalers during this COVID. We would there is a misconception that inhalers would increase the chances of getting COVID infection, which is not true. Uh, you should always be on controller medications and, as said before, exercise and having healthy diet.
Okay, great. Doctor, what are the main causes of asthma? If you could just give a general view of that.
Asthma basically, see, if you have a family history of asthma, you would tend to develop asthma either in the childhood or in the later part of the life. And most of the time, if you have a family history of asthma, it might disappear when you reach 15 years or so. Other, if you're developing late onset asthma, that if you don't have in childhood and developing in 20s or 30s, then it could be the dust, it could be the allergic history, what you have, it could be occupational exposed to some chemicals and all those things. And infections usually doesn't is not the cause for asthma. Infections will trigger asthma, but they are not the basic cause for the asthma.
Doctor, any chronic patient talking about hypertensive or diabetic, they have any direct impact regards to asthma?
No, no. Uh, Asthma is not related to diabetes or blood pressure. Both of them are separate.
Both of them separate. Okay, great. I would request people who are watching us at this time, if you have any questions, you can go ahead, ask Dr. Dr. Ali will be answering your questions live here today with us. If you have any questions, we've got 10 more minutes for the session, and then we should proceed towards the ending. Doctor, has COVID impacted more the asthmatic patients because one of the earlier symptoms of COVID was that breathing difficulty. So it has it really affected?
If you are an asthmatic and you are getting infected, obviously asthma will get triggered. You will have more symptoms. But having a breathlessness because of COVID doesn't mean you have developed asthma. So it could be because of some other problems, not asthma. So if you are an asthmatic, take regular medications, but there is no chance that it will increase the chances of getting COVID infected.
So there is a chance of getting affected, right?
There is a chance, because it is an infection. If you are not wearing mask, you would get, but that will trigger if you are an asthmatic. It will trigger your asthma symptoms if you get infected.
If you get infection, absolutely. So, doctor, before we move on towards the ending of the session, I would really like you to give us a take-home message that would be really very important for all of us.
Basically, asthma is a very common problem, reversible, 100% controllable problem. Globally, there are around 300 to 350 million people having asthma, and everybody live their healthy lifestyle. But you will have to use your medications regularly. You should have a proper action plan. Exercise is must. And other thing is vaccinations. Take your flu shots annually, pneumonia shots annually, and you can also go and take a COVID vaccine. There is no contraindication for not taking vaccine. Why? Because even asthma, there are very less chances of allergic reactions to these vaccines. So I would recommend everybody to go and get your COVID jab.
All right. Thank you so very much, doctor. Just one question before we end the session. What kind of tests will we need to monitor the asthma, doctor?
Basically, we have a lung function test, which needs to be done on a regular basis if you are an asthmatic or if you are suspecting asthma. That is a test which will help us diagnose. It will help us monitor your lung capacity and also help us monitor how well your asthma is controlled. So basically, the lung function test is the main test for asthma.
Okay, great. Great. Thank you so very much, Doctor. Dr. Ali, this was a very quick, short session that we have done with you on this very special day, World Asthma Day. You've covered some misconceptions related to asthma, and that would be really an informative session to all the people who are going to watch later and who are watching at this time. Thank you very much, everyone, for joining us for the session. I wanted to tell that your feedback is really important to us. If you have any questions, you can always write us to myprime@primehealth.ae, and we shall respond to you on your questions. If you want to book an appointment with Dr. Ali, the number is at the bottom of the screen. It's 0470700999, and you can book appointment as per his availability. Or you can download the Prime Health app, and you can download from the Android or iOS, and you'll be able to get the appointment as per the schedule of the doctor. If you have any recommendation to improve ours, so that we can improve ourselves, you can always give us a review on Prime Health Facebook page, and you can watch our videos on YouTube channel with the name of Prime. That will be helpful to you because all our videos are available there for all the information that you really need on different topics. Thank you everyone for joining us today. Thank you so much, Doctor.
Thank you so much. Thank you so much.
As we'll be coming back with another important session sooner, as Prime is all about personalized, personally, this is what we are delivering. Thank you everyone. Take care. Bye bye.
Thank you.